Mitchell, and I want to talk to you today about Candida in men. This is a topic that's not really widely known or discussed. Many women come to see our practice who are suffering with Candida or chronic yeast overgrowth that involves the genital urinary system, and that's why a lot of these women go to gynecologists. But in fact, Candida is equally prevalent in both men and women. So today I want to speak to one of our most interesting patients, as you'll see, about what it's like to have Candida and how you can overcome it. Peter.
Yes.
Welcome.
Thank you.
You've been a patient in our practice for probably over 7 years? Yeah. And when you initially came, you saw my wife, Dr. Ricki Mitchell. And how would you describe some of the symptoms that you were experiencing at that time?
You want me to go through the full list of symptoms I had?
I want to yeah.
Okay.
Yes.
I was in terrible pain.
You were in terrible pain. Okay.
I had terrible bloating.
Right, bloating.
Constant diarrhea. I had already figured out the diet, that you had to eat a no carbohydrate diet before I got here.
Because you noticed that if you ate foods that were obviously simple or complex carbohydrates, that you would bloat up.
Right. I've been going to a gastroenterologist here in the city, supposedly one of the experts, and he didn't have the slightest clue about yeast infections.
Right.
I had constantly read information on the internet, and actually I went to Indonesia and I bought antifungal drugs myself.
Wow.
And they were the ones that stopped the pain.
So that's what you saw actually was the first thing that gave you relief.
Right.
You know, one of the things I like to bring out to anybody watching the video is that Candida really starts in the gastrointestinal tract. That's what people don't realize. It's actually supposed to be part of our system, but it has to be in balance. And obviously, I think in your case, for whatever reason, there was an overgrowth.
There was an overgrowth, and I actually had spread to my lungs. And I had a 30-millimeter tumor in my left lung.
Oh, right, I remember that, right.
And the doctor at Montefiore suggested I had half my lung cut out.
Wow.
And it was your treatment that stopped my lung from being cut out because the Candida was actually controlled, eventually shrunk. I had gone to Sloan Kettering and had a biopsy there.
Wow.
And they monitored it before and after, so I had many CAT scans of the lungs as a result of this.
Oh, that's right, I remember now. And so Dr. Ricki, when she was working with you, obviously she worked with you on the diet, which you were familiar with a little bit already before. And then I guess you found also doing the vitamin treatments along with antifungal treatments, the combination that we do in our program. Does that seem to help you turn the corner?
The most significant reduction in pain happened with the gamma globulin shots.
Oh, right.
That was it. Wasn't the first shot. It was actually several shots, but I dramatically the pain went down very fast on that. I was in horrible pain.
You had lost a lot of weight too, is that right?
I was down to 140 pounds.
Wow.
And my bones were showing in my chest. It was really awful. My face was all collapsed. And you couldn't eat anything, and you had no energy.
Right.
And I had the brain fog. My head was goofy with the alcohol.
Right. And the people watching this should know too, Peter is like this amazing computer whiz. So if he's having brain fog, you know, that's a big problem. Go ahead.
It was the diflucan dramatically cut down the pain.
Okay.
I was on that for a very long time, as well as a nystatin. I was on very high dosages of both of them.
Right.
The nystatin for many years, at sometimes up to 4 million units a time.
Right.
And the 50 milligrams a day of diflucan. But the diflucan wasn't killing all of it. That's when I went to the voriconazole.
Right. We went to another variation of the antifungals, which seemed to help you.
Right. That one actually was 5 months, and that actually was fantastic.
Right.
It really did do a lot to wipe down the Candida. I still had problems in the gut for another 3 years.
Yeah.
But eventually, with all the treatments you gave me,
yeah.
you know, I did fully recover. The yeast in the lung was completely encapsulated. I do have lung damage.
It's probably just scar tissue.
Yeah, it's
really.
scar tissue.
Yeah.
But I'm able to eat anything. I'm able to go anywhere. I can do anything.
Well, that's for sure. I just have to again tell people watching this too. Peter, he's a fascinating person. Not only is he really a computer whiz, and probably one of the originators of the internet, we'll say secretly, but he also has a favorite passion, going caving. I mean, he's been to some of the most unbelievable places in the world, and now he takes groups caving, teaching young people. So this has not held him back at all anymore. So
Well, the Candida was definitely a big problem that held me back because I
Yeah.
didn't have the energy.
right.
Because if you can't take in the calories,
Right.
it's tough to
You
do a
lose your
several days
energy.
in the jungle expedition.
Yes, yeah. Now, yours is a fascinating story, and I really appreciate you sharing it, and I hope it helps some of the men out there who may or may not realize that they have to get their immune system in balance, you know,
Well,
through
the large
balancing
part of the
Candida.
problem is people don't like to talk about their bowel movements.
Right,
You don't want to admit that you have diarrhea constantly.
right. It's true.
You don't want to admit how itchy your groin is,
Yeah.
because I would wake up at night just scratching, and that was
Yeah, no,
a
as I
horrible
said, we
feeling.
see, when we're seeing the men, they've been suffering for quite a long time. They also tend to just wait long until they go see a doctor. But I hope as your example, it shows like how amazing somebody can do.
And it
So
was all
thank you.
caused just by overdoses on antibiotics. I
Yeah.
had sinus problems. The sinus doctor kept on giving me antibiotics and sinuses.
Right.
And then
Yeah, this is a classic story we see with so many patients
and then I
every
took
week.
a couple of drugs which were. I went to South America. I had worms,
Mm.
and when I was treated for worms, they gave me doxycycline and Flagyl.
Right,
And
two
that was
potent
what pushed.
drugs.
Before those drugs, I was okay.
Yeah,
It
that
was
pushed
those
you
two
over the
drugs that
top.
pushed me over the edge.
Yeah.
And on the NIH website, there's a documentation about those two drugs in combination having a higher incidence of fungal infections.
Interesting. Very interesting. I learned something. Anyway, Peter, thank you so much, and I hope again for everyone watching this helps inform you.
Okay.
Thank